Ends around June 15th.
It is something that's extremely common, but a little uncomfortable to talk about and certainly more uncomfortable to experience. This week, we're getting some advice from a Boulder community health doctor on how to manage stress incontinence.
So stress incontinence is one type of urinary incontinence. There are a few different ways that can show up for somebody, but that refers to the type of leaking that a woman or men can have too, but it's much more common in women. When you laugh, sneeze, jump, exercise, do a lot of activities just in your normal life, and then you lose urine that way just because you seem to not have the strength to hold it back.
Now, this is very different than an overactive bladder. Stress incontinence is related to stress on the pelvic floor muscles. A lot of women experience it after childbirth, but in general, this affects 30% of women over 30, 40% over 40, and 50% over 50. Age is a factor, also being overweight or being a smoker and coughing a lot. It's an undertreated condition, but Boulder Community Health OB/GYN Dr. Jeremiah McNamara says it's not something you have to live with.
There are definitely kind of lifestyle recommendations and changes that women can make in their lives in terms of how much water they're drinking, how often they just plan to go to the bathroom even if they don't totally have to, bladder irritants that they take in every day, which are a lot of fun things like caffeine and chocolate and alcohol, artificial sweeteners.
Now, physical therapy, including Kegel exercises, can also be beneficial, and for some more severe cases, there are some fairly minor surgical procedures that can be done.
Well, there are dinosaur bones